Hi everyone, we will be reviewing anti-infectives today. Among the anti-infectives, we have various classes. The antibiotics, we have the antiviral, we have antifungal, we have anti-malarial. For the purpose of this course and for the exam 3, you will be only tested on antibiotics and antiviral. Antifungal and anti-malarial will not be included for the exam. That being said, this is one of the harder part of the exam because there are so many drugs, so many classes, so many mechanisms, and so many interactions with anti-infectives. So I really want you to take the time to prepare for the exam and try to answer a lot of practice questions if you can, do the EAQs, do group studies in order to do well in the exam. I think of all the content, this and the endocrine might be the hardest for you. So that being said, I'm going to start off with the antibiotics. So if you look at the booklet that I gave you, I have two med tables. One is the antibiotic one and the other is antibiotic two. So when you think of antibiotics, these were originally founded way back, accidentally when Alexander Fleming was trying to leave a cup of mold that got really destroyed by this, and that was penicillin, right? The penicillin was invented accidentally several years ago, and not until like early 1900s, that is the 20th century, that antibiotics started being used. I think even after the flu pandemic and the Black Death and everything, people face so many challenges in terms of infectious diseases. And sadly, now we do have the same situation with the pandemic with COVID, right? So antibiotics are primarily given to treat bacteria, which you probably are aware of. And you have already probably heard about antibacterial resistance, right? Like, so we have antibiotics, but bacteria are becoming resistant to many of the antibiotics that we have. And that has caused things like MRSA, like methicillin resistant bacteria. Then we have vancomycin resistant bacteria. Um, so it's getting really hard to treat even bacterial diseases. So if we have another pandemic with the bacteria, it's going to be, another important, thing to keep in mind as to how, as healthcare professions, we will be like managing, all these pandemics in the future. So some certain terms to remember before we know and learn more about bacteria. Of course, from your microbiology, you learn that there are different types of bacteria, the spiral, the circular, whatever, annular. There are so many types and breeds and shapes, gram negative, gram positive, and the list goes on, right? So if you think of community acquired and a hospital acquired infection, so bacteria can be acquired either in the community, right? When you are out there in the community, example, like community acquired pneumonia or community acquired MRSA, or things that can happen in the hospital, like for example, UTIs, urinary tract infections because of bacteria due to E. coli. Or we could have CAUTI, meaning CAUTI, meaning catheter-associated urinary infection. So that's what is hospital-acquired infections. It used to be called nosocomial infections, but nowadays we call it just hospital-acquired infection. So anytime we use things like Foley's or IVs, there's a risk for a bacterial infection too in the hospital setting. So important is to do hand washing, use disinfectants to clean the surfaces, and hand gel, or in some cases like in C. diff, we might have to use soap and water. So we will learn in the next group of drugs as to why some bacteria respond to soap and water. Like for example, C. diff, they have a stronger resistance to the to alcohol. They do not they survive on alcohol surfaces too. So makes us think about the need for different types of hand hygiene as well. So bacteria are morphologically different, and they can be gram positive or gram negative based on where and how they stain. And as far as antibiotics, they can be given for several purposes. For example, you could give them empirically, meaning you go into a clinic and you have an infection, and without finally knowing what type of bacteria is in the system that's caused this problem, they could empirically start you with one drug just to maybe bring the fever down or just to treat the symptoms. But once the culture results come out, it's important to specifically target that particular bacteria. So that is empiric therapy, meaning broader. So definitive is when we know what the bacteria is. For example, a woman goes to the clinic, 30-year-old, diagnosed with UTI. Initially, they'll do a urine specimen, which is important, right? You do not treat anybody without knowing what type of bacteria they might be having in the urine. So initially they might treat with something like a Bactrim, but then when they find that this is resistant to Bactrim, the strain of bacteria, they might treat with Cipro maybe. That's more definitive. So you also need to know these terms called prophylactic and therapeutic and subtherapeutic. So when you think of prophylactic means before going into surgery, some medications can be given to, like antibiotics might be given to patients. For example, cephalosporins might be given for pre-op, for example, in cardiac patients or GI surgeries, or even for surgeries that involve any risk for infection, or if a patient is risk for an infection or sepsis. So we would do something called prophylactic, meaning treating before procedure or an incident. So therapeutic, many times we want many of these drugs to be within a therapeutic range, meaning let's say we want to give Vanco, there is a peak and trough level we need to draw for our patient. Or let's say we need to know, there are some medications like gentamicin that they're really toxic to the body. So we need to really make sure that it's within a therapeutic range. So that also becomes an important part of nursing intervention. So with that being said, I just want to give a preview of the cell itself. That is a bacterial cell. It is a living organism, unlike the virus that you probably have heard in COVID. We do not classify virus as a living organism compared to a bacteria, because a bacteria by itself has a cell wall, it has a nucleus, it has nucleic acid, it has proteins, etc. Right? So the good thing with bacteria is if we don't have resistance, there are antibiotics available either to disrupt or lyse the cell wall itself, the cell membrane, or maybe inhibit the protein synthesis, or even try to interfere with the nucleic acid synthesis. So if you look at these classes of drugs in this table 1 for your antibiotics, if you look at the mechanism of action, it's either cell wall or protein synthesis. So this is something you really need to know and find a way for you to remember which drug acts on which part of the bacteria itself and how it works, right? So I would like to, at this time, tell you that you could skip the carbapenems here, because carbapenems are usually used for severe systemic sepsis type of infection, right? So you could skip the carbapenems, but I expect you to know the sulfonamides, the beta-lactams, the carbapenems, the macrolides, and the tetracycline. So you need to come up with mnemonics to remember examples of these drug names. For example, if I give you macrolide, right, you might have to know, okay, mycins are macrolides. The way I remember, mycins are small, but they're big class, they're macros, right? So I would think, okay, erythromycin, azithromycin, all these are thromycin, right? So I would remember something like, this is an example, you can use anything you want. So throwing a mice, meaning it's a macro thing. So I would try to remember, okay, erythromycin, azithromycin are macrolides. And then I'll try to remember, in general, all these protein synthesis as macrolides and tetracycline. So I would even try to go to that instead of thinking, okay, if I have a mat that's macrolides and tetracycline, the cyclins and the thromycin fall under this category, and they both interfere with the protein synthesis, okay? So this is a little bit of a side tip that I'm giving you, so it can help you to learn this content and remember when you take the exam. All right, so now going back in order, like I said before, antibiotic therapy includes interfering with cell wall or interfering with protein synthesis or interfering with DNA replication. And further, these bacteria, the antibiotics can be either bactericidal or bacteriostatic. So they either interfere and stop it or completely destroy it. So static is maintaining, not helping them grow more. Bactericidal is destroying the bacteria. So you already know, the more bactericidal effect they have, they're more stronger, and then we have chances of them being resistant too, right? So keep that in mind. All right. Anyways, now starting with the different classes. The first class of drug, the older drugs, are generally the penicillin groups. Okay. So if you look at penicillin, you can write it under beta lactams. I'm going to go with beta lactams first. So you can add penicillin right there. So penicillin is an example of beta lactam, and amoxicillin is also an example of a beta lactam. So what happens is they interfere with the beta-lactam ring of the cell wall membrane. Okay, so amoxicillin and penicillin work by interfering with cell wall synthesis by acting on the beta-lactam enzyme, and they are predominantly given for patients who have things like ear infections. You probably have heard about, right? Like amoxicillin for ear infections. And many patients are allergic to amoxicillin and penicillin. Like almost, I think 60% of them carry an allergic to penicillin. So it's really important to think about hypersensitivity and allergies for this um, group of medication. And also remember what type of allergies and how do you manage them. Let's say a patient comes with angioedema and itching, right? And there's lip swelling. That's a severe anaphylactic reaction. For that, you need to give an EpiPen, right? Use an EpiPen. Versus someone with mild itching, mild, things like maybe nausea, vomiting, it's not that big of a deal, right? But you would still want to put that, ask the patient what type of allergies and how do they manage it, or how many times have they had this and things like that. It's really important to like go in a little bit further when they say they're allergic to penicillin, and not to give again another penicillin, because sometimes the second dose might be more potent and have a severe reaction, because the body at the first time might not be reacting, the second time there's producing more antigen antibody reaction, right? So the next class of drugs I would like to bring here is the cephalosporin. So the cephalosporin are they are available in different generations, meaning like the newer and newer forms of cephs or cephalosporin have been developed. If you look at the term sporin, that tells you that it's again from a spore, meaning again it's kind of developed from a fungus, right? So kind of backed off from a penicillin. So cephalosporin, any drug that starts with a ceph, that C, PH, or CEF, fall under this category. So you want to look at the prefix, not the suffix, like in the others, okay? So if you think of cephalosporin, cephalozole, cefepime, cephalaxin, all these ceph, they also work on the cell wall synthesis. However, they are more potent than, even though they're penicillin derivatives, kind of, you want to think of them more as effective for both gram positive and sometimes gram negative too. The newer ones are helpful to treat gram negative. When we say gram negative, those are like harder to treat drugs, just like anaerobic bacteria. So these drugs are usually, you need to know that they're used mostly for prophylaxis, for surgical purposes, and they're very potent in terms of it being able to enter into the blood-brain barrier. So you could help it for treating things like meningitis or infection inside the brain. And then it's also used to treat UTI, only in severe complicated UTI, not an all urinary infection, but some. So the side effects are similar. So again, you watch for any type of, anaphylactic severe allergies type of things, and always give it food. So most of these, antibiotics so far that we've talked about, you give it with food because they can be hard on the stomach in terms of causing GI distress. So most of it, but not all. So the next group I want to talk to you is about sulfonamides. The first category, this is Bactrim. The name is Bactrim. It has a combination of the sulfamethoxazolone and the trimethoprim. You don't need to know that, but just know that it acts differently than the others. It's an anti-metabolite. Important to know is that it's given for patients who have upper respiratory or upper urinary tract infection, and the side effects is sometimes related to hemolytic anemia, so blood disorders, right? Meaning you might want to watch CBC before, and they might have low platelets. So it's important to treat that if they have that problem, right? So hepatotoxicity, nephrotoxicity. So take with fluid. Tell them to take with lots of fluid and with food also for this medication. All right, so the next two classes are the macrolides and the tetracycline. I briefly touched on how to remember these two drugs and how they act. They both act on protein synthesis. So if you think of these two medications, they're usually given to treat gonorrhea, chlamydia. So when a patient comes into the ER with severe or flare up or into the clinic, with gonorrhea or chlamydia, these are sexually transmitted infection, STIs, they might be given both a Zithro and a tetracycline. So usually male or female, if they have gonorrhea, they might have chlamydia. So it's important to treat. And then additionally know that for tetracycline, they can also be given to treat syphilis. You probably heard of syphilis and the complexity of the disease itself, right? Important to know when you give patients tetracycline is to remember that they could cause tooth discoloration, and do not give it to children below 12, okay? Not only because they cause the tooth discoloration, but they can interfere with skeletal development too in children. And further, in adults, we need to also watch for them not taking it along with antacids and milk products. So what happens is when this drug, particularly the tetracycline, which the two drug names are tetracycline and doxycycline, the cyclines, right? We need to be careful to teach these 4 or 5 things, right? Avoid milk and antacids because they have chelating effects, that's CHELATING, meaning they will bind with the drug and interfere. So this drug will not be available. So you just take the tetracycline, but it's not working on your body. So the patient will continue to have the syphilis or the chlamydia or the Lyme, which is not a good thing, right? And the other risk is it can cause super infection. So when you give medications that are very strong, especially these antibiotics, they could remove the normal healthy bacterial flora that we all carry in our mouths and many, like vagina or the other areas. So it's important to remember that it could cause another infection like vaginal candidiasis. So this is pretty much it for the first table for the antibiotics. Just remember a few things what you need to teach the patient, especially to complete the dose, right? That's a huge thing. So the 2 reasons that we might become antibiotic resistant and our country might run out of, antibiotics could be because we become resistant. Either we don't complete the doses, or we or take unnecessarily bacteria, antibiotics. So I think many of us will probably know either one of us or a family member who's guilty of not completing the entire dose, right? If we do not complete the entire dose of antibiotics we are given, we could be contributing to that antibiotic become more resistant because it's not fully, uh, completely erased from the system. It's still there and it's trying to work and become, if you want to say, more smarter, to become more resistant to the drug, right? So important to teach them to complete the dose and monitor, as us as nurses try to monitor for signs, symptoms, and then any other side effects. And of course, monitor for the infection itself, right? Is the fever better? Is the CBC showing a better number of white cells is better? And then how is their cardiac or liver function, if that's probably indicated to be watched in this drug, right? And then more importantly, to make sure that we do cultures before patients are started on antibiotics. Let's say a clinic is busy, you're the nurse, and you notice that the physician missed to order a lab of saying your own culture or urine culture. Maybe you as a nurse trying to be the patient's advocate and antibiotic advocate and trying to make sure the patient gets it, right? So with that said, I want to move on to the second group of part 2 of the antibiotic. That's part 2. If you look here, you have only 2 classes. That's the aminoglycosides and the quinolones. So before we get into that, you want to make sure you know there are some multi-drug resistant type of bacteria. Those are the MRSA, methicillin resistant, Staph aureus. That's a multi-drug resistant. And then we have VRE, vancomycin resistant, enterococci, K is Klebsiella, and E is E. coli resistant bacteria. So you don't have to know all these names, but you just know there are so many antibiotic resistant bacteria already out there, which contributes to infections and probably death too, right? So as far as aminoglycosides and quinolones, you really have to pay attention because gentamicin, ciprofloxacin, moxifloxacin, levofloxacin, these are really very commonly used drug in the hospital settings, okay? So think of aminoglycosides. If you think of aminoglycosides, if you want to remember mycin, right? Remember you had another mycin there, but that was a thromycin, right? So if you want to remember the suffix with mycin, gentamicin, neomycin, tobramycin, these again help with preventing protein synthesis of the bacteria. These are aminoglycosides and they work on gram-negative bacteria. And they are not usually given very often in the outpatient, mostly in the inpatient setting. And they are also given for things like hepatics and encephalopathy. So important to know is that it's nephrotoxic and ototoxic, meaning, you know, the kidney damage is huge and your hearing can be affected. So it's really important to monitor the kidney function and also assess for any tingling, numbness, or anything like in the body in general, and also in the ears itself. Gentamicin needs to be monitored for peak and trough levels. So if you give it in an IV or IV form, you will have to monitor the levels of gentamicin in the blood by doing a blood test and checking for peak level and the trough level to see if you know, it's therapeutically under the range. With that being said, I want to finish up talking about quinolones. So quinolones, queens, if you want to remember, are the floxacins. Okay, I like to remember like the floxacins as the flamingo queens. If that helps for you, you can use that. So if you see floxacin, ciprofloxacin, moxifloxacin, levofloxacin, so these queens are the quinolones, right? They are pretty much used to treat UTI, respiratory infections, STIs. You need to know this. So you need to know Cipro is usually given to treat UTI. The moxi and the levofloxacin are given to treat respiratory infection, and sometimes they can also, all the three can be given to treat STIs, even though rare. Okay, so these are things I really want you to know from this class of drugs, quinolones. More importantly, I want you to know for, particularly for Cipro, remember Cipro is a really important drug to know, very commonly used, because these drugs have some side effects, even though rare. You need to teach the patient, especially if they have any cardiac condition or they're older, they can have something called a prolonged QT interval, meaning if you look at an EKG of a person, you have the PQRST, right? So there is a gap between the Q and the T wave, PQRS and the T wave. So if that gap is prolongated, it could cause, you know, it could cause severe symptoms and also possibly move into something called ventricular tachycardia, which is not a good sign. So prolonged QT interval itself is not a good sign, meaning the ventricles are not effectively contracting. That might lead to poor perfusion. So you don't have to know like inside of it, but just know the prolonged QT interval. And then they could also cause ruptured tendon. So teach patients to report any muscle pain or any joint pain. I've had patients who had taken this and had rupture of the Achilles, you know, the tendon in the Achilles. So if you know that, that's great. But I think one important key point is this is the only group of drug that acts on the DNA synthesis. Okay, it affects the DNA synthesis of the bacteria, not the human, right? So which is a good thing, right? So when you give quinolones, remember it's the interference with the DNA part. So with that said, I want to end by talking a little bit briefly of metronidazole, which is used to treat C. diff. This is really important. So if you hear this term C. diff, if you probably work in the healthcare, you already know C. diff is a very nasty infection when patients have diarrhea that smells like the entire hallway, right? It's very hard to treat. It's very contagious. You need to wash your hands, be on contact isolation for these patients. And then they can be treated with Flagyl or vancomycin. So C. diff is a very a nasty bacterial infection that we can treat either with metronidazole or vancomycin. So with that being said, with the vancomycin, that's usually used to treat MRSA and even C. diff, we need to monitor blood levels. So I will be testing you on vancomycin as well. So when you think of vancomycin, you need to know your book has a really good write up on the side effects, especially the nephro and the ototoxic, just like the gentamicin, and then something called Redmond syndrome. Okay, so when patients have this flushing type of redness in the face, as soon as the infusion is started, you want to like infuse it very slowly to prevent this Redmond syndrome. So please read the book really well. I have quite a few questions on vancomycin. You could skip the linezolid, okay, linezolid or the Zyrox, but also know that Cipro is really important in this in gentamicin. So hope you got some good basics for the antibiotics. Remember, these are like huge classes of medications, and it's hard to cover, in 8 weeks into this entire group of all these medications that we're talking about. So I'm going to post this for you so it's easier for you to review.